Question 1. The pediatric nurse receives a 1-year-old child with a hip speaker cast application to treat hip dysplasia. Which of the following nursing actions should be implemented for the child? B. Apply waterproof tape to the cast around the genital diaper area. The most important aspect of caring for the cast is to keep it clean and dry to maintain skin integrity. Shortly after the child returns from surgery, waterproof plastic tape should be applied around the genital area to prevent soiling of the cast. Use the tape to petal the edges to keep them dry and clean. To help facilitate drying, the child should be turned every 2 hours from side to side and front to back, with the head elevated at all times. If a crossbar is used to stabilize the legs, it should not be used to turn the child because it might break off. After the cast has completely dried, if it becomes damp, either expose it to air or use a hairdryer, set to cool, to help dry the cast. Question 2. The nurse teaching a 14-year-old client about her cervicothoracolumbo-sacral ortho-cis (CTLSO) brace. Which statement by the client would indicate a lack of understanding about the brace? B. I can take it off in hot weather. The Milwaukee brace, also known as a cervicothoracolumbo-sacral ortho-cis or CTLSO, is a back brace used in the treatment of spinal curvatures such as scoliosis or kyphosis in children. It is a full torso brace that extends from the pelvis to the base of the skull. Its aim is to keep the body upright and prevent progression of the curve while the patient is growing and awaiting possible need for operative intervention. The brace must be worn long-term, during periods of growth, usually for 1 to 2 years. The client's statement about not wearing the brace in hot weather is incorrect and indicates a need for additional teaching. The other statements indicate correct understanding. Question 3. A pediatric nurse is educating the parents of a child with cystic fibrosis on how to administer pancreatic enzyme capsules. Which of the following instructions should the nurse include? A. Give the capsules with every meal or snack. Most people with CF need to take pancreatic enzyme capsules before every meal and snack so their bodies can digest the nutrients. Meals and snacks include breast milk, formula, milk, and nutritional supplements. And NBSB. Most pancreatic enzyme supplements come in capsule form. Inside each capsule are many small enteric-coated beads that contain the digestive enzymes. The capsules should be swallowed whole with liquid, do not chew or crush them. For small children, the capsules may be opened and sprinkled on an acidic food, such as applesauce. Snacks or small meals may require a smaller dose. Question 4. The nurse is speaking with the parent of a 3-year-old boy who is being evaluated for Wilms tumor. Which of the parent statements should the nurse immediately report to the healthcare provider, HCP? C. My son has only had 4 wet diapers since yesterday. Wilms tumor, nephroblastoma, is a rare kidney cancer that primarily affects children ages 3 to 4. It becomes rare after age 6. The nurse should notify the HCP of the parent's report of reduced urine output. It could indicate renal dysfunction requiring immediate attention. Children treated for the tumor are at a higher risk for kidney failure. An asymptomatic abdominal mass is often the first sign of Wilms tumor and occurs in about 80% of children with Wilms tumor, abdominal pain or hematuria in 25%, and hypertension or gross hematuria in 5 to 30%. With current multimodality therapy, Approximately 80 to 90% of children with a diagnosis of Wilms tumor survive. The abdominal mass will make clothing tight. Fatigue is common. Food choices aren't related to Wilms tumor, although loss of appetite is possible. Question 5. An emergency department nurse is sent to the scene of a school bus versus train accident to perform triage. Which of these 4 victims should be transported and treated first? A. 16-year-old female with tachypnea, hypertension, and a rigid abdomen. In a mass casualty event, triage has 5 categories, identified by colored tags. Red, immediate, can survive with immediate treatment. The 16-year-old female has signs of internal bleeding and hypovolemic shock. Yellow, observation in stable condition, but requires treatment. Ordinarily, these persons would be seen right away. This is the 8-year-old with the tibial fracture. Green, wait, the walking wounded who will need medical care at some point, but are not in immediate danger. This is the 12-year-old with lacerations. White, dismiss those with minor injuries for whom a doctor's care is not required. Black, expectant, the deceased and those whose injuries are so extensive that they will not be able to survive with the care available. This is the 14-year-old who is already near death. Question 6. The nurse is preparing to administer 240 mg acetaminophen, Tylenol, for a 5-year-old patient. The bottle is labeled 160 mg per 5 milliliters. The nurse will administer A. 7.5 milliliters. To calculate the correct dose, divide the desired dose by the amount on hand, multiplied by the volume. DHXV, for this question, 240 mg heavy division sign 160 mg x 5 milliliters equals 7.5 milliliters. Question 7. The healthcare provider, HCP, prescribes 250 mg per 5 milliliters amoxicillin POQ8-hour for 10 days for a child's ear infection. The parent asks the nurse how much to give their child each dose. Which of the following is the equivalent of 5 milliliters? B. 1 teaspoon. 5 milliliters equals 1 teaspoon. The parent gives the child 1 teaspoon of amoxicillin every 8 hours. The parent should use a medication spoon or dropper to measure the dose, not a household spoon. The nurse should educate the parent about completing the prescription, even if the child starts to feel better. 1 tablespoon equals 3 teaspoons, 15 milliliters, which would be a triple dose. Question 8. The nurse is preparing to administer a dose of ibuprofen oral suspension 3 mg per kilogram PO to a pediatric client who weighs 73 pounds. Pharmacy delivers 50 mg per 2 milliliters. How many ml will the nurse administer? Round to the nearest whole number. C. 4 milliliters. The nurse will administer 4 milliliters of ibuprofen oral suspension. To calculate, use the desired amount x vehicle amount divided by amount on hand or available formula. For this question, 1. 73 pounds divided by 2.2 is equal to 33.18 kilogram. 2. 3 milligrams x 33.18 kilograms equals 99.54 milligrams. Desired dose, 3. 99.54, desired dose, divided by 50 milligrams, amount on hand, equals 1.994. 1.99 by 2 milliliters, vehicle, equals 3.98 milliliters. Round up to 4 milliliters. Question 9. The pediatric EN has prescribed heparin therapy for a child. Before the nurse administers the first dose, which assessment finding is most important? A. Weight in kilogram. The dosage of anticoagulant therapy in children is calculated on the basis of weight-based calculation, of units kilogram. Other medications in children are dosed according to body weight, milligram-kilogram, or body surface area, BSA, milligram m squared. Care must be taken to properly convert body weight from pounds to kilograms, 1 kilogram equals 2.2 pounds, before calculating doses based on body weight. Doses are often expressed as milligram-kilogram day or milligram-kilogram dose. Therefore, an order written as milligram-kilogram D is ambiguous and will require further clarification from the prescriber. Question 10. A high school athlete sustains a severe wrist injury during practice. The athlete's parent takes the athlete to the emergency department. After an examination and X-ray, the healthcare provider, HCP, diagnoses an open fracture and prescribes a splint for the wrist. The athlete asks the nurse why a cast wasn't applied. What is the nurse's best response? A. We expect swelling and need to be able to adjust the splint. A splint, sometimes called a half cast, is a device designed to immobilize an area of the body to allow for healing. Splints are frequently used with soft tissue injuries such as sprains, overuse injuries such as tendinitis, and traumatic injuries such as joint dislocations or complex bone fractures. Fractures that are open or displaced or need surgery where a great deal of swelling is expected can be appropriately treated with a splint. Splints can prevent neurovascular compromise, compartment syndrome. A cast is used for fractures with a minimal amount of swelling. Examples are closed fractures, with no open wound, non-displaced fractures, and displaced fractures after they have been reduced. Question 11. Parents bring their 9-month-old infant to the emergency department, reporting that their baby has been irritable and lethargic for 2 days. The nurse observes poor skin turgor and tachycardia. To obtain more information, what is the best question that the nurse should ask the parents? A. How many wet diapers has your baby had in the last 24 hours? The infant is showing clinical manifestations of dehydration. Asking about the number of wet diapers is a way of estimating output. Normal output for an infant is 1 milliliter per kilogram per hour. Other signs of dehydration in infants are dry mucous membranes, increased thirst, dark-colored urine, high specific gravity, sunken eyes, lack of tears when crying, and depressed fontanelles. The other questions are appropriate but not related to assessing the baby's intake and output. Question 12. The school nurse is giving an in-service to third-grade teachers about characteristic behaviors of 8-year-olds. Which of the following behaviors is characteristic of children of that age? B. They enjoy playing with same-gender friends. 8-year-olds generally love to be part of social groups, tending to prefer playing with friends of the same gender. It's a good age for clubs. They enjoy school and are able to follow directions and solve problems. Their coordination is improving, allowing them to enjoy sports or learn to play an instrument. At this age, they are aware of their appearance and often decide how they want to dress or wear their hair. Question 13. The home health nurse is developing a care plan for a 16-year-old male with Duchenne muscular dystrophy, DMD. The client has limited mobility and is unable to perform ADLs. He is at risk for depression related to which of the following? C. Lack of identity. Duchenne muscular dystrophy and NBSB winking sad smiley DMD is one of a group of genetic disorders that gradually weaken and damage the and NBSB muscles. DMD is the most common muscular dystrophy in children, usually diagnosed between 3 and 6 years of age. Early signs of the illness include a delay in walking, difficulty rising from a sitting or lying position, and frequent falling, with weakness typically affecting the shoulder and pelvic muscle as one of the initial symptoms. Children and adolescents with DMD are at a higher risk for psychosocial issues. Erickson's stage 5, ages 12 to 18, of identity versus role confusion is difficult for teens with DMD because their limited mobility and dependence can prevent them from developing their own identity. Stage 2 is autonomy versus shame and doubt, ages 18 months, 3 years. Both control and possible shame are part of this stage. Erickson's stage 4, ages 5 to 12, is industry versus inferiority, when a child develops a sense of competency. Question 14. The Wong-Baker Faces Pain Rating Scale can be used by all of the following except C. Parents and caregivers. The Wong-Baker Faces Pain Scale is a self-assessment tool that is understood by the patient, so they can choose the face that best matches their physical pain. It is not to be used by a third person, parents, caregivers, or healthcare professionals to assess the patient's pain. It was originally created for use with children, so they could communicate about their pain. It is now used around the world for people ages 3 and older. Wong-Baker Faces Pain Scale used with permission. Question 15. The provider orders gabapentin 18 mg per kilogram per day in 3 divided doses for a child who weighs 28 kilograms. How many milligram will the nurse administer for each dose? B. 168 milligrams. To calculate, 28 kilograms weight x 18 milligrams gabapentin equals 504 milligrams total dosage each day. 504 divided by 3 is equal to 168 milligram per dose. Question 16. After her 6-year-old son is diagnosed with influenza A, the mother asks the nurse how to manage her son's fever and discomfort. The nurse's best response is A. Only give your son Tylenol or Advil. Reye syndrome is a rare but serious condition that causes swelling in the liver and brain. Reye syndrome seems to be triggered by using aspirin, acetylsalicylic acid, or ASA, to treat a viral illness or infection, particularly flu, influenza, and chickenpox. The nurse should advise the mother to give the child acetaminophen, Tylenol, or ibuprofen, Advil, Motrin, instead of aspirin. Question 17. The nurse is educating the parents of a young child with a recent diagnosis of cystic fibrosis. The nurse tells the parents that the child will be at risk for which vitamin deficiencies? C, A, D, and K. People with cystic fibrosis have trouble absorbing fats, which means they also have trouble absorbing vitamins that need fat to be absorbed. A, D, E, and K. These fat-soluble vitamins are critical to normal growth and good nutrition. B-complex, C, folic acid, biotin, and pantothenic acid are water-soluble and easily absorbed. Question 18. A mother brings her 2-month-old infant to the pediatric clinic for a routine checkup. The mother tells the nurse that she's not certain if vaccinations are really safe. What is the nurse's first response to the mother? C. Can you tell me more about your concerns? The nurse should first address the mother's concerns to find out why she is worried and what information she has received. Once the nurse understands more, appropriate information can be provided. There are 4 main categories of reasons that parents refuse or hesitate to vaccinate their children: religious reasons, personal beliefs or philosophical reasons, safety concerns, and a desire for more information from healthcare providers. Question 19. A pediatric EN prescribes nystatin oral suspension 250,000 units POQ 6 hours for a child with a thrush, candidiasis, infection. The standard oral suspension has 100,000 units ml. How many ml will be in a dose? D. 2.5 milliliters. A dose of nystatin oral suspension 250,000 units will be 2.5 milliliters. To calculate, use the desired amount x vehicle amount divided by amount on hand formula. For this question, 250,000 units, desired dose, x 1 milliliter, vehicle, divided by 100,000 units, amount on hand, equals 2.5 milliliters. Question 20. The healthcare provider, HCP, prescribes acetaminophen liquid 160 mg POQ 4 to 6 hours PRN for a child with a fever. Pharmacy dispenses 80 mg per milliliter. How many ml should the nurse administer for a dose? D. 2 milliliters. A dose of 160 mg of acetaminophen is 2 milliliters. To calculate, use the desired amount x vehicle amount divided by amount on hand or available formula. For this question, 160 mg, desired dose, x 1 milliliter, vehicle, divided by 80 mg, amount on hand, equals 2 milliliters. Question 21. A parent phones the pediatric clinic after picking up an antibiotic for their child. The parent tells the nurse, the label on the bottle says to give 10 milliliters every 6 hours. How much is that? The nurse tells the parent that 10 milliliters equals D. 2 teaspoons. The parent should give their child 2 teaspoons of the antibiotic every 6 hours. 5 milliliters equals 1 teaspoon, so 10 milliliters equals 2 teaspoons. Question 22. The nurse in a mental health unit is caring for a 15-year-old who was admitted after a suicide attempt. Which of the following factors is most likely to contribute to an adolescent's risk of suicide? D. Peer pressure and bullying. Adolescents may attempt suicide for many reasons. Erikson's theory of psychosocial development puts teens in the identity versus role confusion stage. Peer pressure and bullying can affect this stage. According to the CDC, youth who report any involvement with bullying behavior are more likely to report high levels of suicide-related behavior than youth who do not report any involvement with bullying behavior. The other answer options are also risk factors for teen suicide, but not as reliable as peer pressure and bullying. Question 23. A parent brings their 6-year-old son to the clinic after the child has been ill for several days. The parent tells the nurse that the child's urine has been dark brown and he has been running a fever. The nurse notes swelling around the child's eyes and in the hands. When the nurse takes the child's medical history, which of the following indicates the child has developed post-streptococcal glomerulonephritis? D. Sore throat 2 weeks ago. Post-streptococcal glomerulonephritis, PSGN, is a disease of the kidneys that occurs after infection with certain strains of a bacterium called Group A Streptococcus, GAS, the cause of tonsillitis, pharyngitis, and scarlet fever. Approximately half of people affected by PSGN show no signs of the illness. When symptoms do occur, it is usually 7 to 10 days after the infection begins. The most common symptom of PSGN is swelling around the eyes. This swelling can also affect other parts of the body, such as the hands and feet. Dark, rusty, or cola-colored urine is a possible early sign of the condition. Children ages 2 to 12 are most at risk of developing PSGN. Group A strep infection is most likely at ages 6 to 7. PSGN usually resolves itself after a few weeks or months. Treatment is directed at controlling symptoms with medication and eliminating any remaining infection with antibiotics such as penicillin. A low-sodium diet may be recommended to control swelling. Question 24. A nurse administers the first dose of hepatitis B vaccine, Recombivax HB, Engerix B, to a neonate at 10 hours after birth. Before their discharge, the nurse then instructs the mother about the immunization schedule for the remaining doses, which will be administered at D. 1 to 2 months and 6 months of age. According to the CDC, the first dose should be and NBSB, given and NBSB, in the hospital within 12 hours of birth, the second dose 1 to 2 months later, and the third dose at age 6 months or later. Note: a mother should be tested for the hepatitis B e antigen, HBeAg, during pregnancy, preferably in the first trimester. If the mother tests positive, the newborn should immediately be given 2 shots in the delivery room, 1 dose of hepatitis B immune globulin, HBIg, and the first dose of the hepatitis B vaccine. If these are given immediately, the newborn will have a greater than 90% chance of being protected against a lifelong hepatitis B infection. Question 25. The nurse is assessing a 3-year-old being treated with Saxima for a diagnosis of lead poisoning. Which test result will be most important for the nurse to review? D. CBC with differential. Saxima, Che-Met, is a heavy metal chelating agent used in the treatment of acute lead poisoning to remove excess lead from the body, especially in small children. It binds with lead in the bloodstream and is excreted by the kidneys. It is generally well tolerated and has a relatively low toxicity. However, mild to moderate neutropenia has been observed in some patients receiving Saxima. The World Health Organization, WHO, recommends obtaining a complete blood count, CBC, with white blood cell differential and direct platelet counts before treatment, and monitoring these values weekly during treatment. If the absolute neutrophil count, ANC, is below 1200 L, therapy should be withheld or discontinued and the patient followed closely to document recovery of the ANC to about 1500 L or to the patient's baseline neutrophil count. The normal range for the ANC is 1.5 to 8.0, 1500 to 8000 L. The other tests are unrelated to treatment of lead poisoning.